Good morning. I'm going to be going over how to use a Cowhorn Explorer. And we're going to first start with tooth number 3, sitting at 10 to 11. Slightly turn our patient away. We're going to establish our fulcrum and retract the cheek. We're going to have this, since we're working on the maxillary, we're going to have the light shining at an angle on the maxillary teeth. And then we're going to establish our fulcrum, identify the working end of the terminal shank parallel to the tooth, insert, and we're going to rock. Then we're going to pivot our instrument, and then we're going to rock across the tooth, and then slowly turn into our mesial, and then we're going to rock into that tooth. Still sitting at 10 to 11, we're going to slightly turn our patient towards us. And we're going to do the lingual using our mirror for tooth number 3. We're going to use the end that's parallel to the terminal shank that's parallel to the tooth to use that working end. We're going to start distally, insert, establish our fulcrum, insert, and we're going to rock. Slowly to make sure we feel everything possible. And we're going to pivot our instrument. Then we're going to go up into our mesial. And we're going to pivot into our mesial. And then rock. And rock. Now we're going to switch to tooth number 9. Now we're going to be sitting at 11 to 12. We're going to just retract the lip. And we're going to, again, choose the working. First, we're going to do our away surfaces. So we're going to choose the end that kind of wraps around the tooth as such. We're going to insert into our mesial. Establish our fulcrum, insert into our mesial. Again, lip retracted, 11 to 12. Insert, and we're going to rock. And we're going to pivot our instrument. We're going to go across the tooth as such, and then quickly pivot into our distal. And rock. Now we're going to do our toward surfaces. So we're going to go insert into our distal, establish our fulcrum, and rock, and then pivot our instrument, and then go along the tooth into our mesial, and then you want to quickly pivot to your mesial. Now we're going to use our mirror, and we're going to follow the same steps. We're going to insert into again, we're going to start with our away surfaces. Insert, rock, establishing our fulcrum, keep the stack close, or as close as possible. Rock our distal. And then we're going to pivot our instrument. And then go across into our distal. And then rock. And now we're going to switch our working end, insert into our distal. You might need to rearrange your fulcrum tally. Insert, rock, rock, pivot the instrument, then go across the lingual surface. And then pivot your instrument into the mesial. And rock. Slowly so you can feel any vibrations. Now we're going to move on to tooth number 22. So we're going to have the patient slightly turn, still sitting at 10 to 11. No, I'm sorry, we're going to change to 10 to 11, I'm sorry. Now we're on the mandibular, so we're going to have our light shining at an angle on the mandibular. Straight down on the mandibular teeth. I'm going to have the patient slightly turn towards us. Again, we're going to retract the cheek or the lip. Whichever one gives you the better view. I'm just going to pull down the lip due to it being an anterior tooth. So now we're going to, again, use the and. So first we're going to do our torus surface. Insert at the distal, establishing our fulcrum. Rock, rock, slowly so you can feel any vibrations. Pivot the instrument, then go across the facial surface. I'm going to do that again so you can see a little better. Again, insert at the distal. Make sure that the terminal shank is parallel. And then rock, rock, rock. Doing our torus surfaces first. Pivot the instrument. Then I'll go across the facial slowly. Make sure you want to feel any vibrations. And then into our mesial. And then we want to rock into our mesial. Now we want to do our away surfaces. So we want to insert. Insert into our mesial, rock, rock, rock. Pivot our instrument, and then go across the facial again into our distal. Okay, now you kind of have a direct vision down, but again, still sitting at 11 to 12, you can use the mirror to either reflect light, or use it for extra sight. So again, we're going to use the end that will wrap best around the tooth on the lingual surface. We're going to insert into our distal. We're going to rock while establishing our fulcrum. Rock, rock. Then we're going to pivot our instrument. Then we're going to go across our lingual. As we go into our mesial, pivoting into our mesial, or rolling into our mesial. And that was our toward surface. So now we're going to flip our instrument. And now we're going to do our away. Establishing our fulcrum again. Insert into the mesial. Rock, rock, rock. Flipping our instrument. Now we're going to go into our lingual. And then insert into our distal. And rock. And rock. Okay, now we're gonna move on to tooth number 28. So this will be, so now we're gonna be sitting at our side position. Have the patient slightly turn away, or have the patient turn away. Using our mirror, we're going to retract the cheek. Again, we're going to choose the side with the terminal shank parallel to the tooth, starting at our distal. So we're going to retract the cheek, insert into the distal, establishing our fulcrum. We're going to rock, 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 rock. Then we're going to pivot our instrument. We're going to go across the facial into our mesial. Now we're going to go to our 10 to 11 position, have the patient slightly turn towards us. So now we can do our lingual surface, establishing your fulcrum with good positioning on the mirror. We want to again using the end with the that's most parallel to the tooth. We're going to start at our distal. Start at our distal. Okay, we're going to start at our distal, and then we're going to rock. Fulcrum established. Rock. Pivot our instrument. Go across our lingual surface. And then we're going to pivot into our mesial surface. And rock. Thank you.